Hi, my name is Daryl Rogers. I'll be your host for the Voices of Truth webcast. Today I'll be talking with addiction psychiatrist Dr. Libby Stuyt, and our topic is coping through quarantine. So tell me a little bit more about your background.
Well, I'm an addiction psychiatrist, so I've been working with people with addiction problems for the past 30 years. And I've been running a treatment program in Colorado that's pretty phenomenal. It's a 90-day inpatient program for people with dual diagnosis, so people that have mental health issues and substance use disorder issues, and it's funded by the state of Colorado. So it's really for people who have failed everything else. So we see the people that have tried everything and can't seem to stop using. And we have really good outcomes. And for most of those 20 years, it was at the state hospital, and that's where I was doing the program. But then they closed the program because they needed more staff, and they closed my program to take my staff. And there was such an uproar from the community, the state, that the legislature agreed to keep it going. But it's in the community now, so it's in a community treatment program, but the legislature has agreed to fund 2 more programs. And so there's 2 other programs coming up similar to what we do. And it's a very intense cognitive behavioral treatment program that's pretty much abstinence-based, and including tobacco. But that's very important. People need to quit everything at the same time, I think. And they have really good outcomes. And I'm actually looking at retiring from that. The other thing I do is I work part-time as a consultant in the community health center here. So it's a federally qualified, fully integrated community health center for the low-income people, the people on Medicaid. And it's a pretty wonderful organization, and they provide medical care, dental care, and then behavioral health care to people. And so I work 1/2 day a week there doing, psychiatric stuff. And that's where I've seen most of the issues with cannabis. I mean, I've always seen cannabis in treatment, in my treatment facility, because people have always used that as kind of a companion drug and, trying to help people figure out how to quit doing that. Mm-hmm. But in the community health centers, where I see so many people using it as a medicine. And so my job there is they have all these primary care docs who, diagnose people with their mental health issues and prescribe medication. And they have behavioral health people that do therapy with them, family therapy, individual therapy, group therapy. And so I get to refer to people that have failed all that. And invariably what I'm seeing are people using high potency marijuana. And so I have to try and convince them that their problems are because of the marijuana they're using. Mm-hmm. That's a really hard sell. I mean, a lot of people really do believe that, it's what they should be on because it's medicine. I think we've done a real disservice to people by giving the message that it's wonderful stuff, safe, green, has no consequences. And so I have to convince people. And it's a hard sell, but I've been successful in getting several people to actually quit. And it's very difficult to quit because the higher the potency of the drug makes it more addicting. And so it's very difficult. And I've, for my entire career, focused on tobacco. That's been the thing I really was pushing, that people need to quit. And that's the hardest one to quit, is nicotine. Mm-hmm. We're now starting to see a similar thing with cannabis, that it's really hard to quit for people that are addicted.
Yeah.
And so that's what I spend almost all of my time doing.
Yeah, I hear that from people. It takes them a while to get to that point. Usually they won't admit that that cannabis is a problem or that it's addictive. Really, this is This is sort of obviously a different time that we're dealing with here. A lot of unique situations, and people are inside, and there are a lot of stresses that people are under that they wouldn't normally be under. Loss of jobs, how are they going to pay the bills, all the uncertainty around it, things like that. So it's creating a lot of anxiety for people. And I think, maybe increasing use of substances to cope with that anxiety for people who are already users, or maybe people who are not users yet, but they're sort of on the teetering there, on the border or on the fence. So I think my first question was, how have coronavirus safety measures impacted marijuana users, people in recovery, or people who may be tempted to use for the first time, from your viewpoint?
Well, I think you're absolutely right. What we do know from research is that substance abuse increases in times of stress and when people are feeling, out of control. And that is something people go to, whether it's alcohol, marijuana, tobacco, other drugs. And so for people who are attempting to be in recovery, this is a high stress time. And so they need to kind of figure out how they can continue working on what they're working on to stay sober. For people that have never gotten into it before, I think it is tempting because, like in Colorado at least, they've made medical marijuana stores essential. And
right.
So they're just as essential as pharmacies or food stores, which I have issues with, primarily because we're not talking about the marijuana of the olden times, and we're not talking about the marijuana that was done in research that showed benefits. Most of the products that are available in the dispensaries now, even the medical ones, are all the really high potency THC products. So the high potency plants and the concentrates. And so that makes them much more addicting, because the more potent a drug is, the more a tendency it will cause addiction. And then that can lead to other problems. And exactly like what you were talking about, cannabis hyperemesis syndrome is one of the significant ones, especially when people are using every day, all day long. And psychosis. It can worsen depression, it can worsen anxiety, and people think that it's helpful, but what it's really doing, similar to tobacco, is it's augmenting the withdrawal syndrome. Mm-hmm. So when you're addicted to something and you don't have it, you're in withdrawal, and withdrawal to any drug is exactly opposite of what the drug does for you. And so if you feel relaxed when you're smoking marijuana, you're going to be much more tense and much more anxious in withdrawal because of the withdrawal phenomena. And so that makes you have to do it again and again. And so what I think people have to do is, try other skills, other things to manage the feelings of stress and anxiety. And those are things that there's lots of things available. Mm-hmm. And we do a lot of things in my treatment program and also at the Pueblo Community Health Center, where we teach people skills and use skills to manage anxiety and stress. Okay.
So what are some of those things that you use?
Well, one of the things I find the most helpful is this simple ear acupuncture protocol. Now, because of physical distancing, we can't really do acupuncture right now, but we can also do acupressure and teach people how to do acupressure. So there's this protocol called the NADA protocol. NADA means nothing, but it actually stands for National Acupuncture Detoxification Association. And so this is a protocol that was actually developed in the 70s, during another opiate epidemic that was happening in the Bronx. And so they found out that you could detox people from opiates using ear acupuncture. And so then we've discovered after 9/11 that this same protocol can be helpful, utilized for stress and anxiety, trauma, people experiencing severe trauma. And so it's been used a lot around the world, and we teach people how to do it. Different states have different laws as to who can actually do the acupuncture, but anybody can learn the acupressure. And so it's basically just applying acupressure to different parts of your ear, because in Chinese medicine, the ear is actually a microcosm of your entire body. So you can actually access all parts of your body through your ear. And the acupuncture has been shown in research to increase production of chemicals in the brain that are beneficial, and also to increase some immunity. So if this is something that people can do, just to massage parts of their ear where they have learned how to do that. And we're coming up with handouts that people can read and look at and learn how to do it. We have videos that are available online that we can share where people can learn how to do this. Other techniques that are available are tapping, like there's a thing called emotion freedom technique. People can look that up on the internet. You can actually watch videos to learn how to do it. But it's actually tapping on acupressure points, and they all have different meanings. They all do different things for people. And you can learn this protocol. It's actually very calming and relaxing. There's another technique called Tapas, or it's named after a woman who developed it. She's also in the internet. Her name is Elizabeth Tapas Fleming, and she is an acupuncturist, but came up with this protocol where you actually you take your ring finger and your thumb and you put it on either side of your nose, and your middle finger goes in the center of your forehead, and you put your hand behind your head and holding your occipital cortex, which is your vision cortex, and doing deep breathing. And then she has a protocol where you actually say things while you're holding that position. So people can look that up. I find that very relaxing to help people calm down pretty much immediately. Mm-hmm. So there's a lot of things that are available out there that, and other simple stuff, that people know about, like exercise. If you can get outside, social distancing, mask, and walk. Just walk is simple enough. Or, eating right, getting enough sleep, spending time with your loved ones, practicing some things other than thinking about the quick fix. And that's really all drugs are, is the quick fix.
Yeah, I've been a kind of an exercise nut most of my life. So that's one thing that seems to help me. I can tell a big difference, especially when I do a high intensity type of workout first thing in the morning. I get the endorphin rush, and it just makes me feel better all over. And it seems like my whole day goes better usually, when I can do that. Sometimes it's difficult to maintain that discipline, to get up early and get it done early. But I've found that to be helpful, throughout my life. You mentioned about the acupressure, reminded me of something. So I have, over the course of my lifetime, I've done some offshore fishing from time to time. And I used to take a little Dramamine here or there, because I've never really been seasick. I felt a little queasy a few times. And my wife went a time or two. She gets motion sickness really easy. But she found this little wristband that you wear that applies pressure to the carpal area, the inside area of your wrist there, and seems to work at relieving some of the motion sickness. Does that work in a similar way, or that?
Absolutely, yes. That's one of the points that they teach people in acupuncture school, that can relieve nausea. There's many points that people can push on, and you don't have to have a license to do that. I mean, you can just push on yourself.
Right.
So, yeah, those are things that people can learn. And I think that there are various organizations are now putting out, even I saw something from the VA, which was a worksheet on different places you can press on your body for different things like headaches, different issues. And so, yeah, definitely. It's amazing what Chinese medicine knows. It's been around for thousands of years. And it's just, I really do believe that a great combination is combining Eastern medicine and Western medicine.
Do you believe that people who are using marijuana, vaping, smoking, do you believe they're at a higher risk potentially for issues with the coronavirus?
Absolutely. And this is something that needs to get out there. There's more and more research coming out that this is one of the significant risk factors. And it's vaping, smoking, anything. But of course, most people are vaping or smoking tobacco. And then a larger percentage of people are beginning to vape and smoke marijuana. And that puts people at significant risk. There was a whole thing, even before COVID came out, was the EVALI, or the effects on the lungs of vaping, which looks very similar to the effects of COVID on the lungs. Mm-hmm. And so that it needs to be something that people need to warn people about. And so I actually think that dispensaries should have this as part of their public service. If they're open and they're selling people products, I think they should be warning people not to smoke or vape the products that they're buying, because it puts them at risk. It puts them more at risk of being susceptible to the virus. And then once they get the virus, it makes the consequences significantly worse. And this has been shown pretty much around the world right now, where increasing deaths are more related to people that are smoking. In China, they definitely saw that, and that's because men smoke significantly more than women do. Women, only like 2 or 3% of women in China smoke, and significantly more, like above 50% of men smoke in China. And so people will say, oh, well, that's just nicotine, but no, it's smoking. Because the tar of tobacco is very similar to the tar of marijuana. And there's even some evidence that THC can make you more susceptible. And so I think that needs to be a big warning. In fact, I just saw today that finally one of the screening tools that the University of San Francisco, or the medical schooling, I think it's San Francisco, has that on their screening tool for COVID is, have you been smoking or vaping marijuana or tobacco, nicotine products?
What kind of preventative measures do you think parents can take right now to prevent their preteens or teens from experimenting with marijuana and other drugs, like especially right now during this time?
Well, I think that the biggest thing parents can do is get educated about it. I think there's more and more stuff coming out that parents need to read. There's this organization, Parents Opposed to Pot, that has a lot of good literature. The problem, as I see it, is because we legalized it, in a way that there was no real regulation, at least in Colorado. It was just like, okay, it's out there and the industry can do whatever they want. And they went around and kind of made everybody think that it was safe and there's nothing wrong with it, while they also at the same time increased the potency of the drug. Most parents don't think there's anything wrong with it. And so they can't really educate their children if they don't think there's anything wrong with it. So I think that we have to get education is the number one thing we can do for prevention. And then you have to have serious talks with your kids about it.
Yeah, and I would agree with that, most of the parents that I talk to are under the impression that marijuana is medicine, that it's not that harmful, and most are not aware of the increases in potency and what we're seeing now in terms of the spikes in the cannabis-induced psychosis and cannabinoid hyperemesis syndrome. Most are unaware that that's going on. So you're right, and I believe we do need more education for parents. So are there any positives? What are some of the positives that have come out of the coronavirus issues, or the self-quarantining that we're doing in terms of just in anything really, but especially in terms of the treatment side or recovery side of things?
Well, I think there's been lots of positives. I mean, I think people are spending more time with their family, which I think can be a really positive thing if people are all working together. And I think, getting back to having meals with all your whole kids, everybody there together, it's a great plan. I think people recognizing how important it is to be able to be out in society and be with people and support each other. That's a real positive. I think just when you see the pictures of decreased pollution around the world, that's a real positive. Right. I think also I just saw that there's been decreased car crashes, and that's a real positive. So I'm hoping that we can take what the positives are and build on them. Yeah. Because I do believe this is going to resolve itself in a positive way. And I think this is, the other thing that we learned is how important healthcare is. How important it is to support our healthcare and preventative health.
Yeah, definitely. That's for sure. But I appreciate you joining me today. And it's been really informative for me. I hope other people out there, I'm sure people are going to get a lot of good things out of this conversation. Is there anything else that you'd like to talk about before we go? Anything else on your mind along these lines?
No, I just hope people keep doing what they need to be doing. Staying home, taking care of themselves, and let's hope this passes soon. But I think you're doing some really good work, so I like hearing what you're doing. Yeah.
Thank you. I appreciate you sharing your insight with me today and with the viewers. And I'm optimistic that we're going to be on the other side of this soon, and that we will learn a lot of good things from it. Thank you so much, Libby. I appreciate you joining us today.
You're welcome. Okay. Bye.
Bye-bye.